everyone. My name is Yali from Zhongshan Hospital, Fudan University. Today, I am honored to introduce our study entitled Deep Learning-Based Breath Hold and Free Breathing Cine MRI for Comprehensive Cardiac Evaluation, which has just been published in the Korean Journal of Radiology. Cardiac Cine MRI is the clinical reference standard for evaluating cardiac structure and function. However, conventional Cine requires multiple breath holds and regular cardiac rhythm. This often causes problems for patients with arrhythmia or dyspnea, leading to artifacts, prolonged scan times, or even non-diagnostic images. Recently, deep learning-based Cine reconstruction has emerged as a promising solution to accelerate imaging while maintaining diagnostic quality. In this study, we directly compared breath hold deep learning Cine and free breathing deep learning Cine with the standard Cine sequence, with a specific focus on patients with arrhythmia and dyspnea. This was a prospective study including 70 participants, 29 with regular rhythm and eupnea, 24 with arrhythmia, and 17 with dyspnea. Each participant underwent 3 Cine acquisitions on a Cigna Premier scanner, standard Cine, BHDL, and FBDL Cine. We evaluated scan time, quantitative parameters, and image quality. In terms of quantitative measurements of cardiac function and structure, we measured biventricular EF, EDV, ESV, and SV. For the left ventricle, we additionally assessed myocardial mass, global circumferential strain, and global radial strain. All measurements were derived using the Simpson method for volumes and mass, with E and DS phases identified by maximum and minimum ventricular volumes. Contour delineation followed the 2020 SCMR standardized protocol, and strain was analyzed using the feature tracking module. In addition to functional and structural parameters, we also evaluated image quality subjectively. 3 radiologists graded Cine images using a 5-point Likert scale, ranging from 1, poor, to 5, excellent. Objectively, we measured 2 quantitative parameters. The first was contrast difference, and the second was edge sharpness. Edge sharpness was defined as the reciprocal of the distance between the 20% and 80% intensity points along the signal profile, as illustrated in the figure. Together, these methods allowed us to comprehensively assess both subjective and objective image quality. Our findings were clear. Examination time was significantly reduced. Standard Cine required about 208 seconds, whereas BHDL Cine only needed 58 seconds, and FBDL Cine 88 seconds. This means a 72% reduction for BHDL and a 58% reduction for FBDL Cine. Quantitative accuracy of the left ventricular parameters was preserved. Both DL Cine sequences showed strong correlations with standard Cine. Precision was better with BHDL Cine, which consistently showed narrower limits of agreement across parameters, supporting higher reliability. For the right ventricle, results were similar, with accuracy preserved in BHDL, again showing higher precision. Image quality depended on the subgroup. In the regular rhythm and eupneic subgroup, 3 Cine sequences performed similarly. In patients with arrhythmia, BHDL Cine provided the best diagnostic quality by reducing rhythm-related artifacts. In patients with dyspnea, FBDL Cine was superior as it minimized respiratory motion effects. In summary, both DLB Cine sequences significantly reduced scan time without compromising diagnostic accuracy. Importantly, BHDL-Cine also demonstrated narrower limits of agreement, indicating higher precision. BHDL-Cine is more suitable for arrhythmic patients, while FBD-L-Cine is more appropriate for those with dyspnea. These findings support a patient-tailored Cine MRI protocol, which improves workflow efficiency, diagnostic confidence, and clinical applicability. Thank you very much for your attention. We warmly invite you to read our full article in the Korean Journal of Radiology